Having a dental bridge is a common solution for individuals who have missing teeth. It not only restores the functionality of your teeth, but also helps improve the aesthetics of your smile. However, proper care and maintenance are essential to ensure the longevity of your dental bridge. In this video, we will discuss how you can take care of your dental bridge to keep it in optimal condition. 1. Proper oral hygiene. One of the most important aspects of caring for your dental bridge is maintaining proper oral hygiene. Just like your natural teeth, your dental bridge is susceptible to plaque and bacteria buildup, which can lead to decay and gum disease. It is essential to brush your teeth at least twice a day and floss daily to remove any food videos and plaque that may accumulate around your bridge. When brushing your teeth, make sure to use a soft bristled toothbrush and fluoride toothpaste. Gently brush the area around your dental bridge, making sure to reach all surfaces, including the gum line. Additionally, using an antibacterial mouthwash can help kill bacteria and prevent bad breath. 2. Avoid certain foods. While dental bridges are durable, they can still be damaged by certain foods. To prevent any damage to your bridge, it is best to avoid hard, sticky, or chewy foods that can put excess pressure on the bridge and cause it to loosen or break. Foods like popcorn kernels, nuts, hard candies, and ice should be avoided to protect your dental bridge. In addition to avoiding certain foods, it is also important to be mindful of how you chew your food. Try to distribute the pressure evenly across your teeth and avoid biting down on hard objects or using your teeth as tools to open packages. 3. Regular dental visits. Regular dental visits are essential for maintaining the health of your dental bridge. Your dentist will be able to assess the condition of your bridge and detect any potential issues early on. During your dental appointments, your dentist will also clean your teeth and bridge to remove any plaque or tartar buildup. If any adjustments or repairs are needed for your dental bridge, your dentist will be able to take care of them promptly. It is recommended to visit your dentist every 6 months for a checkup and cleaning to ensure the longevity of your dental bridge. 4. Use a dental bridge cleaner. In addition to regular brushing and flossing, using a dental bridge cleaner can help keep your bridge clean and free of bacteria. Dental bridge cleaners are specifically designed to clean under the bridge and around the gum line, where food videos and bacteria can accumulate. There are several types of dental bridge cleaners available, including floss threaders, interdental brushes, and water flossers. Your dentist can recommend the best dental bridge cleaner for your specific needs and show you how to use it effectively. 5. Be mindful of oral habits. Certain oral habits can put your dental bridge at risk and should be avoided. Habits like smoking, nail biting, chewing on pens or pencils, and using your teeth to open packages can all damage your dental bridge and compromise its integrity. It is important to be mindful of these habits and make an effort to break them to protect your dental bridge. If you have any concerns about your oral habits and how they may be affecting your dental bridge, be sure to discuss them with your dentist. They can provide guidance on how to overcome these habits and protect your dental bridge. Conclusion. Taking care of your dental bridge is essential for maintaining its longevity and ensuring your oral health. By following these tips and incorporating them into your daily routine, you can keep your dental bridge in optimal condition and avoid any potential issues. Remember to practice proper oral hygiene, avoid certain foods, schedule regular dental visits, use a dental bridge cleaner, and be mindful of your oral habits to protect your dental bridge for years to come.